Hi everyone, I'm Elaine Q. Hermoso from BSP 2-4. In today's video, we're going to talk about the male hypoactive sexual desire disorder. Male hypoactive sexual desire disorder is characterized by a lack of desire for sex and deficiency or absence erotic thoughts or fantasies over a 6-month duration. The clinician must be careful to distinguish between a desire discrepancy between partners and this disorder. A man who has lowest sexual desire for his partner will not qualify for this diagnosis if he has other erotic fantasies. It is common that typical triggers of sexual desire decline with age, so counselors should take care in the diagnosis and treatment for these disorders. Factors that contribute to this disorder include that of temperamental, such as mood and anxiety, environmental, such as excessive alcohol use or social and cultural influence, and genetic or physiological, such as age and testosterone levels. Treatment specific to medical intervention. What would I recommend for a client who has hypoactive sexual desire is to go to their primary care provider so then we can rule out any underlying biological issues such as with testosterone levels. Since all of them are going to be off-label and that can cause some issues, as with any disorder, try to reduce your stress, exercise more, and improve your diet so then you're eating healthier just in case that could cause the hypoactive sexual desire. So now, let's talk about the treatment specific to psychological and emotional intervention. Provided a detailed sexual history that examines the client's current adult sexual functioning as well as his childhood and adolescent sexual experience, level and sources of sexual knowledge, typical sexual practices and their frequency, medical history, drug and alcohol use and lifestyle factors. Second, assess the client's attitudes and funds of knowledge regarding sex, emotional responses to it, and self-talk that may be contributing to the dysfunction. Explore the client's family of origin for factors that may be contributing to the dysfunction, such as negative attitudes regarding sexuality, feelings of inhibitions, low esteem, guilt, fear, or repulsion. Assess the role of depression in possibly causing the client's sexual dysfunction and treat if depression seems casual. A study found that increasing emotional intimacy will increase sexual desire machismo in the understatement that men should always be ready to have sex is a great source of shame. For those men struggling with male hyposexual desire disorder, bring in a couple together to get ways in which they can work to aid healthy sexuality decreases shame. Couple counseling is done with 5 basic components. First, the complete sex history of both partners is taken into consideration. Next, the counselor can educate and evaluate thoughts, emotions, and behavior in feedback sessions to this. The couple can learn a couple sexual style that suits their current lifestyle instead of romanticized in the good old days. Then the couple must learn the good enough sex model. In this model says that cotton cloth sexual perfection is not realistic. Finally, the couple continues their be and behavior that will prevent relapse. Intimacy must be continued if the couple wants to encourage desire. And lastly, the treatment specific to spiritual intervention. There are many factors that contribute to the male hypoactive sexual desire disorder. It is important to note that one's worldview regarding self and others influences one's sexual experience. The fact that at the half of a man with a history of psychiatric symptoms may suffer from moderate or severe loss of desire confirms the sexual complication largely originated directly or indirectly from one's belief. These beliefs may include shame, fear, guilt, and despair. Sexual disorders in men are not widely understood, acknowledged, or treated. Simply knowing that someone cares about what they're going through to be the catalyst for change that most men are lacking. To effectively support someone suffering from this disorder, a counselor must understand the partnership between cognitive power and spiritual transformation. Counselors can help their clients identify the negative beliefs associated with their lack of sexual fulfillment by meeting their clients in their current state, by assuring that they are not alone in their struggles, by encouraging a positive self-image to the theory of differentiation, and by recommending couples therapy to contribute to the team effort of affirmation. So that is a very brief explanation about treatment of male hypoactive sexual desire disorder. Thank you for watching and God